Receive habit. People with heart conditions such as atrial fibrillation or congestive heart failure. For some people using SPAP or who have obstructive sleep apnea. This can trigger the development of central events known as treatment-emergent central sleep apnea. When people live at high altitudes, this can cause central apneas to occur. How common is sleep apnea? Sleep apnea is uncommon but widespread. Experts estimate it affects about 5% to 10% of people worldwide. How does sleep apnea affect my body? To understand how sleep apnea works, it helps to know a little bit about the human sleep cycle. Sleep happens in multiple stages. Stage 1, light sleep. This is a short stage that begins right after you fall asleep. It accounts for about 5% of your total sleep time. Stage 2, deeper sleep. This stage is deeper and makes up about 45% to 50% of all the time you spend sleeping. This number goes up as you get older. Spend sleeping, this number goes down with age. It's very hard to wake someone up in stage 3 sleep, and waking up directly from it usually causes sleep inertia, a state of mental fog and slowed thinking. Parasomnias like sleepwalking and sleep talking happen in this stage. REM sleep. REM stands for rapid eye movement. This stage is when you dream. When a person is in REM sleep, you can see their eyes moving beneath their eyelids. When you fall asleep, you typically enter stage 1, and then move into and cycle between stages 2 and 3. After cycling between those stages, you'll ultimately go into REM sleep and start dreaming. After the first REM cycle, you start a new cycle and go back into stage 1 or 2. One cycle normally takes about 90 to 110 minutes before another begins. Most people go through 4 or 5 cycles per night, assuming they get a full 8 hours of sleep. How sleep apnea disrupts your sleep cycle. Your brain constantly monitors your body's status and adjusts your heart rate, blood pressure, breathing, etc. Your blood oxygen levels can drop when you stop breathing because of either apnea or hypopnea. Apnea. This is when you stop breathing while asleep or have almost no airflow. It combines the Greek roots a, which means not, and ne, which refers to breathing. Combined, it means breathless. Hypopnea. This combines Greek word roots hypo and ne. The root hypo means low or under. Combining these root words means under breathing or low breathing, which means you aren't breathing enough to maintain oxygen levels in your blood. Mild sleep apnea. This level means a person has an AHI between 5 and 15. That means they have between 5 and 15 apnea or hypopnea events per hour. However, healthcare providers also consider symptoms at this level. If you don't have other symptoms, they may not consider it severe enough to treat. Moderate sleep apnea. People with moderate sleep apnea have between 15 and 29 events per hour. That means a person who sleeps 8 hours stops breathing and/or wakes up between 120 and 239 times.